I'm Susan Taylor with Scripps Health in San Diego, California. Glomerular disease affects the kidney's ability to filter waste and remove excess fluid from the blood. Getting a handle on it helps protect your kidneys from failing. Joining us to talk about this is Dr. Zhabiz Solhjou, a nephrologist with the Scripps Clinic Medical Group. Doctor, thanks so much for being with us.
Of course, thank you for having me.
So go into more detail. What is glomerular disease?
Glomerular disease refers to inflammation and at times scarring of this part of the kidney functional units called glomerulus. And they're commonly known as rare kidney diseases, but they're common enough that about 10 to 15% of patients on dialysis with end-stage kidney disease had glomerular disease as the reason for kidneys failing.
And what causes this disease?
The etiology of glomerular disease is pretty broad. It could be anywhere from medications, genetic causes, or autoimmune diseases, meaning where body's immune system produces excess antibodies or abnormal proteins and antibodies that can affect the kidneys.
And what are the symptoms?
So symptoms could be very subtle or a little more pronounced. Commonly, people present with swelling on their legs, ankles, hands, and sometimes around the eyes, but also foamy urine, changes in the urine color, having it pink or red or even cold-colored at times, or tea color, they call it. And just elevated blood pressure could be symptoms of glomerular disease.
And how do you diagnose this disease?
So we do multiple testing to diagnose these conditions. We start usually by a kidney imaging, whether it's an ultrasound or a CAT scan, but more importantly, we'll do a urine test to look for presence of any blood or protein. We send a urine sample for protein quantification and also do a series of blood tests that could guide us to what kind of disease we're dealing with. However, commonly when it comes to glomerular disease, we need a kidney biopsy for it to confirm the diagnosis.
And how do you treat it?
In certain conditions, we, depending on what glomerular disease we're dealing with, the treatment could be different. Sometimes we just need to treat the underlying disease, like diabetes. We need to make sure the diabetes is very well controlled. Or if somebody's blood pressure is elevated, we work on lowering the blood pressure because it can also help us lower the protein in the urine. We use multiple medications that help us lower the protein in the urine. And for some glomerular processes, we need to do immunosuppression to use medications to lower the immune activation in the body, suppress the immune system so it doesn't fight off the kidneys.
Scripps has a glomerular disease clinic. What goes on there?
In our glomerular disease clinic, we provide subspecialty care to patients suffering from glomerular disease. And we do have a broad range of medications to offer, as well as clinical trials for some of these conditions. Doctor,
who is most at risk for this disease?
Different glomerular diseases affect different patient age range. Some of them present themselves early on, some even at childhood. There is the most common glomerular disease is called IgA nephropathy. It commonly affects patients in their 20s or early 30s, and some affect people later in life.
Glomerular disease can either be primary or secondary. Explain what that means.
So primary causes of glomerular disease mainly target the kidneys as their target organ. However, secondary causes are commonly secondary to another condition going on affecting the body, such as diabetes or infections, or at times autoimmune diseases like lupus nephritis.
Is there a genetic component? If somebody in your family has been diagnosed with this, does that increase your chances of getting it?
This is not true for all glomerular disease, but some glomerular disease have either a genetic etiology or having some genetic mutations could put you at a higher risk of developing that disease in the future.
Can glomerular disease be prevented, for example, if you implement certain lifestyle changes?
Most glomerular diseases cannot be prevented. However, lifestyle modification definitely goes a long way in preventing decline in kidney function. Mainly weight loss. If there's diabetes, good diabetes control, good blood pressure control, exercise, smoking cessation, they can all impact the kidneys and help lower the rate of kidney decline.
If you don't get a handle on this disease, doctor, what can happen?
Unfortunately, without proper treatment for these conditions and lifestyle modifications, commonly they end in end-stage kidney disease. So if somebody controls their risk factors very well and gets a proper treatment for these conditions, we can really slow down the decline in kidney function for most of these glomerular diseases.
Any final thoughts, doctor?
Well, I suggest if anybody experiences symptoms of glomerular disease, like swelling of their legs or face, or any changes to the urine color or foam in the urine, to get it evaluated, and if there is any glomerular disease, to get care at a center that specializes in this, because thankfully now we have multiple medications available that can slow down the decline in kidney function or prevent kidney failure.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you for having me.
If you want more information on glomerular disease, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.